So the rotator cuff. So I think the first thing is to understand what is the rotator cuff. So your shoulder blade has a socket on it, and that socket is a golf tee. And the ball on the top of the humerus is the golf ball. And so the ball sits on a pretty flat surface. And so you have to have muscles to hold that ball into the socket to provide the leverage when you raise your arm. So when you hold your arm straight out to the side, it's like taking a baseball bat and holding it out there. You got to have something to hold on to that so your arm doesn't fall down. And that's what the rotator cuff does. It helps to stabilize that ball into the socket so you can move it through that mid-range of motion. If somebody develops a tear of the rotator cuff, the vast majority of the time it's a misnomer. Most rotator cuff tears are wear and tear or degenerative, okay? Some of them are traumatic. So the way I explain it is this. As you move and raise your arm, the ball raises up and it hits under the roof of the shoulder at a certain point, at about 120 degrees of elevation. So when you raise your arm up and the ball hits under the roof of the shoulder, it can pinch on the tendon. And some people it leads to an abrasion effect, okay? If you lead to an abrasion effect of the tendon, then it can wear it thin. It's like wearing the same pair of socks every day and you never change them. The tissue under the material under the heel can start to wear thin. If it thins, that's what a partial tear of the rotator cuff is. And that's common. About 1/3 of the population has a partial tear of the rotator cuff. If you continue to wear it so thin to where you wear a hole in it, that's what a rotator cuff tear is. Those also are very common. Over the age of 60 in the United States, about half of the population has some degree of tearing of the rotator cuff, whether that's partial or full thickness tears. But most people have no idea about it because largely they're asymptomatic. It's just like wearing a pair of socks that have a hole in them and you don't realize it until you do something that you get a blister on your heel, right? So traumatic are different. Traumatic tears typically are some injury or trauma. It could be somebody who trips and falls, gets in a car wreck, tries to lift something too heavy and their arm gives out. So if you have a traumatic tear, they're different. It's just like putting your sock on too hard one day and you rip a hole in the bottom. So that looks different than the one that you wore a hole in slowly. So they look different, they act different, and the treatment is largely different. If you have an acute tear, okay, they do not have the ability to heal on their own. Degenerative tears do not have the ability to heal on their own, but an acute tear can progress much more rapidly. It can retract, the muscle can shrink and turn into fatty tissue, and once that happens, it may not turn into muscle. So if you have a young person who has an acute tear and they can't move their arm and they're weak, it's not going to heal and it may be worse with delayed treatment, so you may consider doing surgery earlier on those individuals. A degenerative tear is different because they take longer to develop and they can progress at a slower rate of time. So those are things that you can manage conservatively because some people can live with a rotator cuff tear and never really have any issues with, especially if you're older. And so largely with those is we try to treat conservatively with methods to improve the range of motion, maybe with physical therapy. We do medications or anti-inflammatories, and we do cortisone injections to try to reduce their pain. And if they can function and they can use their arms the way that they want to do, then they live with it. And if it gets to the point where they fail those non-operative measures, then that's when you may consider doing surgery. The symptoms that you would have with a rotator cuff tear are largely going to be as you raise your arm out away from your body. As you do that, it usually leads to pain. The pain is going to be up on the top portion of your arm. Sometimes it can travel down the arm to the mid portion, especially if your bicep tendon can be involved because the bicep tendon is right adjacent to where the rotator cuff attachment is. And so pain is one of the things whenever you reach out away from you. The other is weakness. So when you reach your arm out away from you at shoulder level, you don't have as much strength. Or if you're trying to do something up overhead and change a light bulb, you just don't have the endurance anymore. So those are different symptoms that people have. And then certainly nighttime. Why do you have pain at nighttime? It's a subconscious thing. It's how do you lay it? If I lay on it, if I lay off it, it's difficult to explain, but it just causes night pain. Usually it's a fall. It's usually either a fall and you try to catch or brace yourself, and what happens is there's a sudden move where the ball wants to move across the socket. If you try to catch yourself or grab onto a railing when you're falling down, and when that happens and the ball shifts really quick, then sometimes it could rupture or tear the tendon away. a surgery for a rotator cuff repair, there's two ways to do the surgery. There's one way where you make a cut or an incision in the skin and you open it up to look at it, to reattach it. And then there are ways that you can do minimally invasive where you can look into the shoulder with a fiber optic camera and you can use long instruments while viewing it on a TV screen, and you can reattach the tissue back down to the bone. The way you do that is you look in there with a camera, you can find where the tissue is pulled away from the bone, you clean off the surface of the bone, and you can place anchors that are like small drywall anchors that go into the bone. Those anchors have heavy stitches that you lace up through the tissue, and you can tie those stitches to hold the tissue down onto the bone. It gives it an opportunity for the tissue to heal. The reason it doesn't heal without surgery is because the joint fluid bathes through that area. There's a hole in it, and the fluid from within the joint leaks out of that hole, so it'll never heal on its own. It's only going to get bigger. If you surgically attach it or repair it down to the bone, then your body has the ability to scar back in to close off that hole. But it takes about 10 or 12 weeks for that to occur. So the downtime is similar to what you would see with a shoulder replacement, where you have to rest it for 4 to 6 weeks. Then you start a stretching process, and then you start a strengthening process after that 10 to 12 week mark. So you can then start to get back into regular activities. And usually by 6 months, people are back doing similar things to what they were doing prior to the surgery.